This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Okay, so for a lot of people, going to the doctor for a checkup can be a little stressful. The uncertainty of, am I going to have a shot? Mm-hmm. Is he going to diagnose something bad?
Mm-hmm. Then there's the fear of asking your doctor about something that might be a little embarrassing. Well, consider this. Most doctors have seen or heard it all, and they're not judging you. Even so, we are here to ask the questions for you in our series, Ask the Doc. And here to answer those questions is Dr. Chris Snyder, the Chief Informatics Officer and Hospitalist with Peninsula Regional Medical Center. Thanks for coming back.
Thanks for having me.
Yeah, we've got another Ask the Doc. Nothing off limits. You ready?
Go for it.
Okay, we're going to start off with our first question. About 2 months ago, about 2.5 months ago, I was bitten by a tick in a private area. It is swollen and itches. What do I do?
Yeah, everybody worries about Lyme disease with ticks, and we are in a fairly high Lyme area. We do see some Lyme disease. That's usually not the cause, though. Ticks carry a lot of bacteria, especially in the groin area. You have a lot of things called lymph nodes in there, which is kind of your trash compactors for the body.
Right.
So basically, when you get stung in that area by the tick, and it is a sting, they inject into the blood some bacteria, and sometimes you can get local infections. They get red and hot and can get pretty nasty. If you start running fevers with it or you see pus with it, it's a good idea to get one of us to take a look at it. You may need antibiotics, you may not, but in most cases it resolves on its own. It gets itchy, lasts about 2 weeks most of the time. So, but you will get swollen lymph nodes in your groin, and it can be pretty uncomfortable. At times.
Okay.
All right. Well, next question. For years, my feet have been cracked and they itch. I've tried so many creams, but nothing seems to help. What could it be?
Yeah, the old foot problem. You ever had your kids take their socks off in the car? Wow.
Oh, yeah.
So the cracking can be a lot of things. Most commonly, though, it's athlete's foot. Everybody calls it athlete's foot, which is a fungus. So it's a nice, moist, hot environment, so plants like to grow there. Funguses are plants. They grow in the skin. The problem is if you're older and you have diabetes or you have other underlying immunocompetency issues, you can really have some problems with that, and the cracking can cause infection that can spread to your blood. So, so it's important to take care of your feet. Your feet are pretty important. They're the furthest from the heart, so that cracking can cause some issues. There's other problems that can cause it, dermatology problems like eczema, psoriasis. There's a number of different things, but most commonly it's athlete's foot. And there are over-the-counter stuff you can use for that, but the best thing to do is keep them dry and air them out once in a while.
All right, let's go on to our next question. How important is it to wash my fruit?
Fruit is pretty dirty. Actually, anything you get from the store you need to wash.
Yeah.
I'll be honest with you. I don't know if they've done bacteria counts. I'm sure somebody has, but it's important. There's insecticides and even the organic stuff. I mean, you never know who's handling it. We always love, and Jimmy and I love not shaking hands, but you know, the hand-to-mouth issue, you get a lot of infections from your hands. So clearly, if you're washing the fruit, you're washing your hands at the same time, so it has the same effect. But it's important to at least rinse it off, even when you take it out of the fridge after sitting for a week. Re-rinse. So that doesn't hurt to get a little water on it.
Now, this is one that I think it was a hot topic for a while, but I hadn't heard about it in just a little bit. Are there any risks when it comes to getting tubes in my son's ears? Tubes
are, again, you're seeing less and less tube utilization. 25 years ago when I did some pediatrics, it was clearly being utilized a lot more because we didn't have alternatives. Antibiotics are also the other thing that has been used less in kids with ear infections. Chronic ear infections require multiple treatments, evaluation by ear, nose, throat specialist, but there are risks with tubes. Yeah, there's risk with any procedure. I don't care if you're getting a flu shot, you can have a local reaction. You know, again, you just got to be aware that anytime we break Mother Nature's God-given barrier, there's a potential for infection, bleeding, anything. In most cases, it's a very benign, quick procedure, and the ear, nose, and throat guys do it so much, it's relatively safe.
But they still use anesthesia with
Absolutely. That. Yep, there's always that risk, and usually an anesthesiologist is available. Having 2 docs in the room working on you is probably a good thing.
Yeah. Okay, here's another one, and this is an interesting question. Sometimes I have to go to the bathroom. It just hits me, but I have a phobia of going in public places. Will that have an impact on me?
Holding your urine, actually, we talked about this a couple segments ago, stretching that bladder absolutely has a problem. In men, it can enlarge the prostate too. So there's muscles that hold that liquid in, and as the bladder stretches, it becomes less responsive to the normal response of feeling like you have to go. So that feeling of having to go is something, it's your body telling you to do something. So most time you need to do it and listen to it. Truck drivers have a notorious issue with this. A number of folks who have long periodic sitting periods can have challenges without the restroom.
Okay, that's number one. What about number two?
Your bowels.
Absolutely, yeah. So same effect. There's muscles, and it can create problems and tears and bleeding and hemorrhoids and all sorts of stuff in the perirectal areas. So there are clearly some problems with that. If you get the urge, find a place, get it done.
Take care of business.
Yeah, take care of business.
Yeah.
Okay, so here's the one that I've been waiting for all day long. How do you pronounce that?
And it's interesting. A lot of people don't realize every drug has a chemical name. So there's Tylenol and then there's acetaminophen. It's the same drug, same contact, but that's called the generic name. So acetaminophen.
Acetaminophen.
It's clearly one of the, there's a whole bunch of chemical names we don't use usually. Because they are so long, it could be really complicated. The drug companies have done a good job of making them simple and kind of catchy with the trade name. So, but there's two names for every drug, just to make it that much better.
Yeah. Well, Dr. Snyder, as always, thank you so much for, let's do it again next month. How's that sound?
Great, thanks.
All right. And to read more about Peninsula Regional Medical Center or to submit a question you'd like to ask Dr. Snyder, go to delmarvalife.com.